I wanted to talk about osteoporosis today. Osteoporosis is a weakening of the bones, and it actually is very common as you get older. It occurs in 30% of all postmenopausal females. The reason it can be very dangerous is because it can lead to fractures, whether you have a fall, you're at a high risk for a fracture if you have osteoporosis, or it can lead to fractures in the spine called compression fractures. And this doesn't have to happen due to a fall. So some of the risk factors that can lead you to having osteoporosis that you can modify are diet, exercise, whether or not you smoke. So if you do smoke, you want to stop. And then we'll talk about exercise because this is physical therapy. So studies have shown that a good strength training program can improve bone density by 1% bone growth a year versus the normal amount with osteoporosis losing 1% a year. So I'd rather gain that 1%. But strength training is site specific. So if you have osteoporosis in the hip, then it'd be really important to strength train the hip. So squats, stuff like that. And if you have osteoporosis throughout the spine, which is also really common, back exercises, spinal extension exercises are really important. Aside from strength training, there are a couple other things that are also really important, such as like balance training. You don't want to have falls if you have osteoporosis, so this is really important. And postural training. To have good posture, just in case you do have that osteoporosis throughout the spine, you want to avoid compression fractures in the vertebrae.